How do pain scales help manage sickle cell pain? Imagine trying to describe a pain so intense it feels hard to put into words. That's where pain scales come in. They are simple tools that help patients with sickle cell disease tell their doctors how bad their pain really is. Since pain in sickle cell can change from mild discomfort to severe agony, these scales give a clear picture of what the patient is experiencing. This helps doctors decide the best way to treat the pain, whether it's with over-the-counter medicines or stronger options like opioids. Pain in sickle cell disease is not just physical. It can also be emotional and psychological. Pain scales are usually filled out by the patient, who rates their pain on a scale from 0 to 10. 0 means no pain, and 10 means the worst pain imaginable. This simple rating helps healthcare providers understand how the patient feels, especially since pain is a very personal and subjective experience. Sometimes, patients might not be able to fully explain their pain, or they might not trust their healthcare team. Pain scales help bridge that gap by giving a common language to describe pain severity. Using pain scales allows doctors to see if a pain episode is mild or severe. If the pain is mild, they might recommend simple pain relievers like acetaminophen or non-steroidal anti-inflammatory drugs. If the pain is more intense, they can decide if stronger medications, including opioids, are needed. These scales also help monitor how well a treatment is working over time. If pain levels decrease after medication, it shows the treatment is effective. If not, the doctor can adjust the plan accordingly. Pain scales also help in deciding when urgent care is needed. If a patient reports a very high pain score, the healthcare team can act quickly to prevent complications. They can also use this information to tailor opioid doses carefully, avoiding undertreatment or excessive use that might lead to side effects. For patients managing pain at home, knowing their pain level helps them decide when to take medication and when to seek medical help. However, pain scales are not perfect. Because sickle cell pain can be unpredictable and influenced by emotional states, the scores might not always tell the full story. Trust and communication between patients and providers are essential. Healthcare providers use pain scales as one part of a comprehensive assessment that includes understanding the patient's medical history, emotional well-being, and social factors. In the end, pain scales are a valuable tool in managing sickle cell pain. They give patients a voice to describe their pain accurately and help doctors choose the right treatment at the right time. When combined with clinical judgment and personalized care, pain scales improve the overall management of this complex disease. Always remember, if you or someone you care for has sickle cell disease, talk openly with your healthcare team about pain levels and treatment options. Your health and comfort depend on clear communication and expert guidance.